Hello, and welcome to AHS Health Matters. I'm your host, Kelly Morris. We're here today to talk to local health and wellness experts to find out more about how to live a healthy and happy life. We're here today at the Cor Van Ray YMCA with Chloe Trautman, talking to us about vaping prevention in youth. Chloe, what is vaping?
Yeah, it's a great question, Kelly. Vaping is a new epidemic that we're seeing definitely among our youth population. Vaping essentially kind of mimics the idea of conventional cigarettes, but you inhale a liquid that turns into an aerosol, and that is exhaled into the air. And so what you're seeing is that vaping contains some nicotine, flavors, and chemicals to create that aerosol. And it goes by various names. So some people call them e-cigarettes, some people call them vapes, some people call them e-cigs, e-hookahs, those types of things. So, and they can even be called by their own brand name. So you might just find that people call them differently depending on where they are. And they also are shaped differently. So some of them look like a pen, some of them even look like a USB, and they can be concealed that look like school supplies. There's a video that Health Canada has that shows the similarities between school supplies and the look of some vapes or e-cigarettes. So it can be quite alarming and quite conceivable. So yeah, it's something to keep in mind that people look for how they appear, and they often have flavors that entice kids and teens, unfortunately, like they have candy flavors and fruit flavors. I'm not sure if you've ever smelt them when you walk by somebody's, they have a strong smell and not like traditional cigarettes or tobacco. So yeah, it's quite alarming.
How harmful is vaping?
Yeah, it's a great question. So we're still learning about the long-term effects of vaping and what it does to the body in a young person and in an adult. But what we do know is that most vapes have nicotine, and that affects the brain development of a young person. And it can affect their memory and their concentration. So it's really highly addictive for them. It can also cause intense cravings and really nasty withdrawal symptoms. So something that we don't want to experience. And sometimes young people can get hooked more easily on nicotine than an adult can. And vaping, they have harmful substances, and some are known to cause cancer and lung disease. So really unfortunate things that we don't want to experience. And in some rare cases, there are defective vapes, and they can cause a fire or an explosion. Vaping comes with a risk of burns and other serious injuries, so things that we have to keep in mind.
How common is vaping in young people? Is it even legal?
No, it's not legal. It is illegal for anyone under the age of 18 in Alberta to possess or use a vape. So retailers who are potentially selling to minors are also held liable if they are selling to anyone under 18. There is a number and a website that you can go to if you are aware of a retailer who is selling these vapes to youth. So you can go to the online website of ahs.ca/EPH or call 1-833-476-4743. And this matters because most teens who vape report getting vapes and e-juice from acquaintances, friends, family, and they're purchasing them from these retailers who aren't checking for ID potentially. And so the vaping rate among young people in Alberta has definitely spiked recently. We are actually at considered along the same lines of national averages across Canada. So 1 in every 10 junior high students in grades 7 to 9 say they have vaped in the past 30 days. And this number jumps up to 1 in every 3 for grades 10 to 12 students. And research tells us that kids and teens often underestimate the harms of vaping. They don't associate them with conventional cigarettes. They see them differently. So you can't compare the two. Oftentimes, if you talk to a youth, they consider smoking traditional or commercial tobacco to be, stinky and not very nice, but they don't see vaping that same way. And so what the teens are saying is it's enjoyable, they like the buzz it gives them, and they're a bit curious to try them, especially with all the different flavors that you can get out there. And so some even believe that it will help reduce their stress, and we've often heard that comment from parents as well, saying they find that their child is a bit more calm, and that is potentially associated to that vape. And it's a lot of the schools are seeing this problem really front hand at the schools, and so my team at Alberta Health Services, we did a environmental scan at the schools, seeing what's going on, how they're dealing with this problem, and how we can help to support them. And a lot of times these students are being punished for having a vape on school property because it is illegal and it isn't to be possessed on school property. And so we're trying to find ways that we don't have that punitive measure for the students. We have more of a restorative practice that we try and have for the students instead. So yeah, there are lots of measures happening in the school level, but it's something complex that we need to tackle together.
Well, and how can we talk to our teens at home about the risks of vaping?
Yeah, it's really important that we have these types of conversations, and it's not just a one-time conversation either. It needs to happen repeatedly, happening in real time when you maybe see a vape shop or something as you drive by, and just kind of mentioning it, trying to have that open conversation, not being judgmental, using credible sources to have conversation with them. So Health Canada has a great youth program that you can watch videos, and there's a self-led module as well. It's called Consider the Consequences of Vaping. It's really well done, so I would encourage anybody, even a school, to look into this, but for parents as well. There's lots of youth-friendly videos as well on there. And even when it comes up, just trying to talk to your child about what the consequences are if they vape. Maybe they don't have as much money, or maybe it affects their participation in school sports, or maybe it affects their sleep, or those types of things, just trying to kind of relate it to what's maybe happening in their life. Maybe they spot it in a video game or a music video or things like that. So just having those types of conversations, helping them think and act independently and making good decisions, and helping them reflect on their values and their judgments as well. If you do find that your teen isn't wanting to have that conversation with you, maybe as the parent, maybe you can suggest them talking to somebody else, another adult that they trust, whether it be a sporting coach, a teacher, a faith leader, those types of things, depending on what it is, but just letting them know that you're there for them, and to just continue that open and honest and respectful dialogue with them.
So where can we go for more resources to prepare ourselves to have these conversations at home?
Yes, it's a great question. So you can talk to your healthcare provider about it, or you can call 811 and speak to a registered nurse. If you're finding that you need help because your child maybe is already vaping and they need some help to quit, you can go to Alberta Quits. They have information on quit counseling, text messaging, phone calls from a tobacco educator, but there's also specific vaping apps out there that help vaping prevention apps out there that help people quit their vaping use, and it can be a little bit enticing to youth because they have those colors, and it's a little bit less formal than talking to a tobacco counselor through Alberta Quits. So whatever the preference there might be. And as well, Alberta Health Services just recently launched a 2-year information campaign for ages 13 to 17, and it's about the harms behind the haze of vaping and vaping products. So the campaign messages are based around vaping and toxic chemicals, vaping and mental health, vaping and addiction, and vaping to help them stop. And so you can learn more about this campaign at behindthehaze.ca. And information about this campaign will be shared through social media, movie theater screens, schools, any type of event that maybe there would be a lot of youth at. And I also wanted to highlight, to help educators, caregivers, or individuals, that a Curb the Vape checklist was created by South Zone Health Promotion Facilitators. So if anyone is interested in receiving this checklist, it has a lot of helpful resources on it. You can email healthpromotion.south@ahs.ca.
That's wonderful. Thanks so much for coming and sharing all of this information today. It's a very important topic, and hopefully this helps prepare everyone to have those important conversations. Thank you so much. Today virtually by Cathy Gladwin and Naomi Fowler. They are health promotion facilitators on the population health promotion team from the Edmonton zone. Thanks so much for joining us today. We're talking about the Not Falling for You Falls Prevention Program. What is the Not Falling for You program?
Well, Not Falling for You is a falls prevention program for older adults. It offers weekly balance training classes in locations within the community. Classes are led by trained volunteers who are also older adults, usually from the community. The cost for participants is kept very low, so that takes a barrier away and makes it accessible to everyone.
Why is preventing falls in older adults important?
Well, in Alberta, as well as Canada, between 20 and 30% of seniors will have at least one fall each year. In addition, each year in Alberta, falls by seniors account for over 34,000 emergency department visits and over 9,000 hospital stays. After a fall, older adults may be injured and need recovery and rehabilitation, as well as lose their independence and abilities to do things they enjoy. Furthermore, 40% of admissions to nursing homes are a direct result of a fall. So we can see that the impacts of a fall are far-reaching on the individual, their family, the healthcare system, and society. But here's the thing: while the likelihood of a fall can increase as we age, falls are preventable and are not a normal part of aging.
Who is the Not Falling for You program designed for?
Not Falling for You is designed for community-dwelling older adults. That's those who are living in their home or an apartment, but are not dependent on assisted or supportive living. We want to attract people before they have fallen and who need primary prevention of falls. As for an age, we want anyone who sees themselves as being an older adult to participate. So they are usually over 50 years of age, but they could be 90 or more. It is suitable for people who are independently mobile, but may use a walker or a cane to get around. Participants are generally healthy or have managed health issues. It is important that they are cognitively able to participate so that they can follow directions and learn new skills. And our participants need to be open to a volunteer-led program. The program is aimed at those who may not be comfortable in a gym or fitness center, or wearing fancy fitness clothes, but we want it to be a really comfortable and inviting environment.
Excellent. You just mentioned that the class is led by volunteers. Can you tell me about that?
Yes, the class is led by peers of the participants. So they are also older adults, 50 plus, and they are very likely from the same community. The leaders are volunteers, and they usually don't have previous experience as fitness leaders. So the leaders are not professionals in exercise. They are one older adult leading other older adults through a routine of balance training. They take a one-day training course to learn to lead a specific set of exercises. Plus, we reimburse them for the cost of a CPR class that improves the safety for the participants. In exchange for the leader training and CPR course, which has a total value of about $300, the volunteer agrees to lead at least one 12-week session. But it's so fun, they often want to do more. We were successful in applying for a grant from the New Horizons for Seniors program, and that has covered the initial cost of training our first set of peer leaders. This peer leader model has been used successfully for other types of programs, for this type of program in other locations. In addition to keeping the costs low, having volunteer leaders empowers the participants and creates a social connectedness amongst the participants.
Sounds like there's a lot of benefits to both the leaders and the participants. So where are these classes held?
We work with a variety of community organizations to host the programs. The host organizations may be community leagues or seniors organizations or churches that have a facility in the community. The host organization provides the space for the classes so that it might be in the community hall or in a church or even just in a meeting room. The facility is near where the participants live, so it is within walking distance for many or a short drive for others.
Could you tell me a bit more about what the classes are like? What will participants experience?
Absolutely. So the classes are just over 1 hour in length. Each class starts with a 10-minute warm-up. So we start with walking and gentle arm movements to get the heart rate up and to lubricate the joints, as kind of shown in this initial clip. We also do some dynamic stretches to loosen up the muscles. That's followed by about 10 or so minutes of strengthening, which focuses mostly on the lower body and core muscle groups. We use our body weight for the strength exercises using the large muscle groups of the body, so the program doesn't need to have any additional equipment on hand. And the movements are very functional and are movements we might do every day. So for instance, this clip is showing a sit to stand strengthening exercise, which you can see mimics the very functional movement of getting up and down from a chair, sofa, toilet, and so on. This is followed by about 30 minutes of balance exercises. This is the key component of the program. Each balance exercise has been researched by the University of New Brunswick and has been shown to be effective to prevent falls. There are several types of balance movements, and the program addresses each of them. This clip is showing a single leg forward reach that challenges functional stability limits, which is helpful for activities like reaching for items in the grocery store. This next exercise uses a phone app called Clock Yourself. Participants pretend they are standing in the center of a big clock face, and when a number is called, participants then step onto that number. So for instance, when they hear a 12, they would step forward. When they hear a 6, they would step backwards, and so on. And this addresses something called reactive control. The final portion of the exercises is a 10-minute cool down that includes walking, arm movements, and gentle stretches. The classes end with a discussion of how to manage fall risk. Topics include things like managing medications, wearing proper footwear, having your vision checked, and removing hazards from your home. We support the discussions by linking participants to print material provided to us by the Finding Balance program.
Oh, that's wonderful. What a program. How was all of this content developed for these classes?
Well, we initially partnered with Physical Culture Alberta, and their program is called Purposeful Movement for Older Adults to use as the curriculum to train our peer leaders. We combined this with exercises that, as I mentioned earlier, have been researched by the University of New Brunswick and are used in a similar program they offer in New Brunswick called Zoomers on the Go. The falls prevention information we use for the discussions comes from our partner, the Injury Prevention Center at the University of Alberta, and their falls prevention initiative called Finding Balance. All of the content we've included has been shown to be effective at reducing an older adult's risk of falling.
So is attending the Not Falling For You class just once per week enough to prevent falls?
Okay, that's a great question, Kelly. So, while once per week is better than not working on balance at all, the research does show that doing balance training 3 times per week year round gives the greatest benefit. So, to assist participants in training their balance 3 times per week, we teach exercises and give the participants resources to do balance movements at home on their own. We also connect participants with the Zoomers on the Go online classes. By offering these additional options, we are encouraging participants to get the recommended 3 times per week throughout the year.
And what feedback have you received so far about the program?
Well, from our very first pilot of the program, we have seen some positive results. Measures of falls risk showed improvement after the very first session. As well, in surveys, we found that participants found the program to be both beneficial and fun. Participants felt they have learned new skills and gained information to prevent falls, and they are making more connections with people in their own communities.
And from your experience with the program so far, is Not Falling For You meeting the needs that it was designed to meet?
Yes, Kelly, we think it is. We want to help people prevent falls before falling impacts their lives. And by getting into the communities and reaching older people there, we are doing this. We want to remove barriers to participation, such as financial barriers and cost and traveling to classes. So by engaging organizations to host the program and using volunteer leaders, we have kept the costs very low. By operating the program in numerous locations, travel is minimized for participants. We want to make the program friendly and welcoming for people who may not have a personal history of taking part in group exercise, and the feedback says we have. And by teaching exercises that the participants can do on their own at home, and by connecting participants with the online Zoomers on the Go program, we are helping our participants get the recommended dose of 3 balance training sessions per week. And mostly, we want to provide a program that is effective at reducing falls risk in seniors. So by incorporating exercises that are based on the latest research and including strength building in addition to the balance, we are specifically reducing falls, and we are confident that participants are getting the best value for the time that they invest in the classes.
And what do you see in the future for the Not Falling For You program?
The program was initially offered in Edmonton and surrounding communities. We are sharing our program elements and expertise with interested AHS colleagues. That way they can offer it in communities that they work with as well. If you email injury.preventionedmonton@ahs.ca, we would be happy to give you more information about the program. And you can also visit the website of Finding Balance, and that is at findingbalancealberta.ca, and that will give you more information about falls prevention.
Thank you so much for all this information today, Naomi and Cathy. Thank you for joining us from the Edmonton Zone and sharing all about fall prevention.
Thank you very much, Kelly.
Thank you, Kelly.